In terms of some of our further investments on things like home care, it's not going to be up to us to decide exactly how that care is delivered, but we would like to share that discussion. We'd like to hear the ideas. Obviously, appropriate mechanisms will be put in place for that money to be used. We also would like to be helpful to the provinces and territories in the area of measuring what Canadians can expect, and we do that through organizations like the Canada Institute for Health Information. So there are a number of ways that the federal government is there to help. We want to be a good partner. We want to be helpful. We believe that there's huge value in us being a partner at the table and helping the provinces and territories to deliver on our shared priorities.
We all agree on the importance of providing those services, but those services are more than just transformation. They require money as well. We had the example of dialysis. Well, the suggestion that maybe invest less in dialysis and more in keeping people's blood pressure under control so that there would be less need for dialysis. Well, that's great, and we are all working towards that end, but you still have to provide dialysis today because that individual who needs it will be dead in 3 weeks without it. So you can transform, and we have to transform, but we have to do that in a way which respects and understands the need to sustain the existing system, and that those transformations in many, if not most cases, will require either a transitional time or new investments to allow them to happen effectively.
I absolutely understand, and I'm open to discussions around details around how additional money will be allocated outside of the Canadian Health Transfer as well. So I think it's fair. It's Canada's healthcare system that we are advocating for and working for every day in our own jurisdictions. And I think it's fair for us to talk about some of the conditions that Alberta's government will certainly achieve in response to increased allocations. But rest assured, there is need in all parts of our country for increased allocations.